Baratka, Paula Hodek, Robert Kopish is excused, Patricia Stephen,
Here.
Dennis Wortko is also excused, Nicole Kulwicki, Sally Hummel,
Here.
Suzanne Acker,
Here.
and Gerald Swenson. Thank you.
Okay. And at this time, I'd like to see if there's any public comment. Do we have anybody online? I don't see just anybody. It's not usual time for people, I suppose. No one out in the audience there, out in the group? All right. Seeing none, we'll move on to communications, and I'll move that over to Sarah.
Okay, I'd like to introduce Nicole Kowicki, and she is taking place on our human health and human service board. We have to statutorily have a nurse practitioner, doctor, and also a registered nurse. She'll be taking the place as our nurse practitioner on the board. And so, if you'd like to say a little bit about yourself.
Hello, everyone. I'm Nicole Kulbicki. I am a family nurse practitioner, and I have been one over the past decade. Prior to that, I was a nurse and practiced for quite some time as well. I am working for Marathon Health at this point in time, and I will be staffing the on-site clinic at BW Paper Systems. So that's it.
Thank you.
Mm-hmm.
Well, we welcome
You, Nicole.
Thank you.
Real thrilled about that. Any other communications from anyone on the board? Okay, hearing and seeing none, we'll go on. Let's talk about the new employees. We're going to have Kayla. Why don't you start first and introduce your new member of your department?
This is Kristen Overturf. She is our new family skills worker. She's been with us for about a month now, and I think she has some things to say.
Sure. I'm Kristen. Nice to meet all of you. Previously, I worked at Chequamegon School District for about 8 years as a special ed para. That will help me greatly in my role as a family skills worker, working with the kids. All right.
She's hit the ground running already. She hasn't grasped her.
Kayla, would you come back and introduce yourself? Nicole?
Sure. Hi, Nicole. I'm Kayla. I'm Oregon.
Oh, they know each other?
Nice to meet you.
Oh, from Tailored Health, sure.
Yeah.
Okay,
But nice to meet you. And welcome.
okay.
Yes.
Thank you. Dawn?
Hello, everyone. So I'm Dawn Griesel, and we've met before too. So nice to meet you. Welcome. So anyway, I'd like to introduce our new disability benefits specialist. Where is she? So this is Melody Jorgensen, and she started on Monday. So this is her third day. And she put pictures up in her office, so I consider that a really good sign. And so she's doing very well, and very happy to have her. Did you want to say anything?
I just wanted to say I'm happy to be here. Thank you. Thank you.
And then Carrie.
Hi, I'm Carrie. I'm the Health and Human Services Fiscal Admin Supervisor. I'm very excited to introduce Katie V as the newest member of our team. She recently located from the Milwaukee area to Phillips, and she's eager to embrace the life in the Northwoods. She has a diverse background in teaching and experience as a medical receptionist. She brings a wealth of knowledge and a genuine passion to helping others. Katie has a husky named Yuka, and in her free time, she enjoys skiing and reading. Did I miss anything?
That was good. Thank you. Excited to be here, day 2, and I'm having a good time. So
Good, good. Well, thank you. We'd like to make sure that Kristen, Melody, and Katie are welcomed here into our county. I think you'll enjoy it. Thank you very much, girls, for bringing them up. All right, let's go to our vouchers. Did they get all the way around to 1, 2, you have them all. All right, so then I need a motion for, to approve them.
I would make a motion to approve.
Motion's been made
I'll second.
and seconded by Ms. Steven. Any discussion? Bob's not here. But he said he'll get back to you next time. Anyway, all right, hearing and seeing none. All those in favor?
Aye.
Aye.
Those opposed? Okay, motion carried. Thank you, Chris Ann. Go back and just take a deep sigh. All right, we have the minutes also in front of you. There is one thing I do want to change on the back side of that. At the very end, it talks about our next meeting would be at 3:00 and it was to be at 3:30. So you might want to make that change. Any other changes or any questions about the minute? No, I need a motion first. Any motion to approve?
Motion to accept the minutes.
Okay, Mr. Gerald.
I'll second.
Second, Ms. Steven. All right. Now, any discussion? Hearing none. All those in favor?
Aye.
Those opposed? All right, those carried. And annual report 2024. Who's giving that report? You are?
The annual report, I believe, did everybody get a copy, Carrie? I mean, you made a copy, did everyone get one? Okay. This is a rough draft. And so what we usually do is we give you our rough draft so you guys are able to look at it, take it home, and view it. And then what we're going to do at our next meeting is we will have it finalized so that you'll be able to, if you have questions, I'll have all the managers here and we'll be able to go through it. Each manager will go through their section. Apologize taking it. Takes a lot. Carrie's worked extremely hard, but waiting for managers to get numbers and the director to helping out and finalizing things as well. So it's put together though, almost all the information is in there. There might be just a few additions and would let you know if there's any additions in there. Probably like the table of contents and things like that will be added. So hopefully in a couple weeks, we'll be able to get that to you guys earlier than even just a couple days before the board, the final one is what our kind of goal will be.
Do you have a copy to put into Mr. Kopesh's and Mr. Wartko's mailbox or not?
Yes.
Okay.
There are a couple extra copies up there.
Oh, they're up here. Okay, we'll make sure that those get in there. Okay, thank you. We'll make sure that that gets on to next month's agenda and go for that. Good. All right, thank you. The Public Health Unit, Tiffany Polachek. Fee schedules. It's in here somewhere.
Hi, I am Tiffany Polachek. I am the manager for public health and the health officer. So I welcome you, Nicole. We've been in contact a little bit via email. Last year, or I think it was 2 years ago, we had presented the fee schedule for public health and for reproductive health. I was going to bring along the public health one, but we need to get a few things clarified. So I'd like to bring that forth next month, if that's okay, just because I wanted to double check a few things. I am ready though to present the reproductive health one, which looks like this. Amanda was able to update it to include the current MA rates. So the only things that had changed on there are those ones that you see in the bright yellow, which is our H1010 code. It was 136. We're now putting it at 175. That's after our cost analysis, and also the increase in MA, you can see went to 168. So we needed to increase our cost there. That's the education portion that we provide during reproductive health. And then if you see the lower one, that's the levonorgestrel. That is our eContra supplies. That was also raised from $39 to $42, and that's due to the cost of the med itself. So those were the changes since 2023. And in order to implement those, I'll need an approval from the board.
What's your pleasure, board?
I'd make a motion that we adjust the fee schedule as presented.
Okay, motion's been made. Okay. Susie Ocker seconds it. Any discussion, any questions for Tiffany? Okay, hearing and seeing, that you didn't raise your hand, right? No, okay. Hearing and seeing none. Thank you, Tiffany. All those in favor?
Aye.
Those opposed? All right.
Thank you.
And we'll put the next one on for next month then too. All right, sure. Thank you. Aging and Disability Senior Services Unit. Chris is not, oh, Chris is here. There you are. Well, I know. Hi, Chris.
So I'm Chris Maybe, the Senior Services Supervisor.
Want to turn your microphone on?
Oh,
please?
sure.
I know it's your favorite.
So I'll give my quarterly report. That is this in your packet with the little colorful little diagram. So this is for April, May, and June. The number of people that received home delivered meals were 68. The number of people that participated at the sites were 153. The total meals served in April, 1583, May, 1595, and in June, 1681. In May, we did receive a donation of supplies. The Phillips dining site did from the American Legion Auxiliary 122, which included baggies, gloves, kitchen items, containers. The Senior Farmers Market, we so far distributed over now 117 vouchers. We have roughly 25 left now. Transportation program, in that quarter, the volunteer drivers, which are 6 of them, drove 7,821 miles and volunteered 252 hours of their time. The average number of meals provided in June, Park Falls had 41, and Kennan with the lowest of 10. So you can kind of see the other ones there. The community outreach program coordinator, that would be Cheyenne Litvinoff. She submitted her quarterly report of everything that she's been working on over the last 3 months. So, which she kind of laid out on the second page back here. So, includes Strong Bodies information, what she's been doing at the nutrition sites in April, May, and June, at least offering. Sometimes we don't have any attendance, but at least we're trying to offer different things. For some of the senior nutrition programming in May, it was Older Americans Month, so she provided bags with puzzles, fidget spinner things, and programming information that went to all the home delivered and congregate meal participants, roughly 130 total. She's helping me work on reassessments for the home delivered meals. And that's about it for that. Any questions?
I've got a question, but it's not about that.
Okay.
I'm from Brentwood, and our AED, the battery's dead on it. So do you think it's best if they replace the AEDs? I mean, I don't know if the other ones have the same problem. Do they have AEDs in the other ones?
I don't know. I remember years ago when we first got that, though.
Yeah.
And I don't know if that was donated or I can't recall. Yep. I will make note of that and look into it. Okay. But the batteries are dead right now.
Batteries are dead right now, and it is, I forget when we had that put in. But anyway, it's probably need a new one.
Yeah. Okay. All right. I'll check into that.
But that is a good question about the other sites as well.
Mm-hmm.
Might have to check those.
Yeah. Yep.
I mean, all you'd need then is, if the other ones don't have it, is to just train them on how to use it.
Mm-hmm.
But it is instructions and it tells you step by step, so
Sure.
I'm pretty sure the site managers especially would have to know that.
Mm-hmm. Mm-hmm. Yeah, let me look into that.
So
We are
Do we
old.
know if the AEDs are being checked, if that battery's being checked every month
Hmm.
by the site manager?
Mm-mm. No, I wouldn't think so. I think if I remember right, years ago when Janine was still here, she worked it out. I don't know if Hank Went was involved in
Right.
getting that, and I don't even know if the other sites have them.
Right.
I'm not sure.
Joe, do you have one at your, oh, not at the town hall, you don't have a site there, huh?
No.
But,
No,
right.
no.
But I just wonder if any of the town boards would help, or if they're held at some of the town halls.
Right, right.
They could help with that as well. I mean, they meet monthly, so
Sure.
I mean, that could be part of their,
And they meet at the, let's say, the Ogama Library. They meet in the community room the
Sure.
town does
Okay.
there. So,
okay.
yeah.
It's it's something to look at.
Yep.
Okay. Good question, though. Thanks.
So when I was at the county, at the highway commissioner, if I remember correctly, we got one at the highway department from the Office of Emergency Management, Roxanne.
Oh,
And I don't know if that was specific to the county or if there was a program through emergency management that they could get those. So maybe that'd be something to touch base with the Roxanne on and see if there's a program.
Was one at the airport.
At the, yes, yeah. Yeah.
and maybe
And
they're,
back to Nicole's question, is there a requirement for those to be tested?
Right.
monthly? I mean, I guess.
Probably.
Is there?
But
So if
there's
we're having
probably,
it there, we should almost make sure that we're following the requirements
Yeah.
as far as.
In a healthcare
Maintenance.
setting, we do have to check those on a regular basis and actually sign off. There is like a little button where you can almost like turn it on to verify that the battery is working. So, yeah, that might be a good thing.
Yep.
Since they're there,
right,
we
right,
need to know that they're going to be able to be used.
right,
Mhm.
working. Okay.
and if you have to look at purchasing some of them, maybe there are grant monies out there
Mm-hmm.
for such a thing. So,
Right, for
good
sure.
question.
Do the fire extinguishers get checked?
I'm assuming by the
Assuming no.
fire department.
Yeah, that would be,
I used to do it when I was on the fire department,
yeah,
but I'm not on it no more. And I don't think anybody's.
that
I'll
would
have to
be,
check.
yeah, that would be the requirement of the municipality that the building's owned by.
Mhm.
So for instance, county, it would be the county responsible for checking highway and every other fire extinguisher. If it's a municipality, it's the municipality's responsibility. Even if there's a site there being used like this, it's still the municipality's responsibility, I believe.
Right.
Is there a contractor that does it for the county?
Yes, yep.
No, they go around, I see them. check that it's-
Oh, that's a case.
Yeah.
Mm-hmm. Mm-hmm. Yeah.
Okay.
I'll make a note.
Anything else?
Not on that.
Okay.
So then I have the Nutrition Advisory Council. Notes from there. We met on July 31st in Kennan at the Kennan site. I just went over some new additions that we have, which was hiring a new site sub in Park Falls, Nancy Olson. She subbed for Dawn quite a bit already. We also have a new sub driver from Margaret, who delivers the home delivered meals in Park Falls. When she's not subbing for Dawn, she volunteers to run a second route that we started in Park Falls. So she does a 5-field route and a small in-town route now. So then Dawn can stay at the site, doesn't need to leave and do that route. And that's going well. Let's see. We elected, or they did, a new chairperson, which is Deborah Warner, and the vice chair is Bill Hoffman. Let me see. Most of the comments this time around about the meals were good. Just a couple minor concerns, but overall, it was a good meeting. So our next meeting is October 30th, and that's in Park Falls. Then we have the Council on Aging meeting. We met July 14th in the here in the county boardroom. The chairperson elected was David Schmidt. The vice chair was Diane Gearman. The minutes were reviewed. Nutrition program information, we reviewed the meal site statistics from May. Let me see here. The total congregate meal contributions for that month were $3,480. Contributions for home delivered were $4,100. Discussion on promoting the dining sites through radio, church newsletters, other community programming. I mentioned there as well, Nancy Olson was hired as a sub in Park Falls. The Ericksons, Lauren and Cindy Erickson, started driving the Prentice Ogama route, delivering meals. The nutrition program surveys were reviewed. They're done annually. And requests for proposals for the nutrition program bids will go out within the next month for the nutrition program. I talked about the senior farmers market, transportation. We talked how drivers were recognized in April by the driver recognition lunch. The meeting date will be changed in March of next year. It was moved to April 13th, which will be the second Monday in April. And our next meeting is September 8th at the Peace Lutheran in Park Falls at the site. Any questions?
No? Okay. Thank you, Chris. So now we have economic support. Sarah.
Every year we have to bring this to the Health and Human Service Board, this policy, to have you approve it. This is that policy that provides crisis assistance through the WEEP program for ones that are imminent risk of losing home energy sources during the heating season, and that's assisting them. And then, I mean, I won't read it to you because I believe you guys are probably pretty familiar with this since we've done it the last few years. But they have requirements in order for us to give them money in order to have their sources, heating source turned back on. And so I need an approval for this here.
I need a motion for that.
I make a motion that we approve that
Mr.
for
Swenson.
the heating.
Exit motion with. And a second with Nicole Kolwicki. Any discussion? Any questions for Sarah this time? Yes, Pat.
Do we get to see what the income and number of people in the household numbers are?
I can bring that to you. I can see if Amy has that, or if you want me to send that out, or I can bring it next time. I don't have it with me.
Okay,
Yeah,
next
yeah.
time.
Absolutely.
Next time.
Okay.
Yep.
Thank you.
Any other questions? If not, I would ask for.
Madam Chair, do you mind if I
Oh,
have a
I'm
comment?
sorry. Were you waving your hand? I'm
No,
sorry.
I didn't.
Okay, you may.
Well, I was just curious. You said this is to help so they don't get their heat turned off, which is a good thing. Don't get me wrong, but I didn't think the utilities could turn the heat off during certain months of the year.
What happens, like sometimes they'll run out of fuel oil.
Okay.
Is what we run into a lot of, is that fuel oil. and getting the fuel oil, and they won't come out and fill it
Sure.
unless there's a, yeah. So thanks for clarifying that though.
Any other questions? Any other discussion? Hearing none. All those in favor? Those opposed? All right, we will approve that again, the application. And Carrie Krupp with Fiscal Administrative Unit, High Cost Placement Reports. If you're new to the board, you miss out on the really wacky ones she used to have with all those cool.
Oh,
It was like a roadmap
I
gone wrong.
don't think they made much sense.
Kind of interesting.
Okay, so you have your high cost placements reports in front of you with a snapshot of like the last several years. I do know for the children and youth high cost placements, we're going to continue to see an increase in that. I know the last meeting Kayla had spoke of a couple of high cost placements that were coming through and hopefully kind of phasing out towards the end. But I do know she said that there's another one that'll be coming in probably starting in August. And I think, what was that, like almost 20,000 a month?
Only moved back to price.
Mm.
And so they're 6 months, so they're in placement.
Yeah, so she's still hoping, and it's looking good that the one that would be rolling off in October, that will happen. But so yep, we'll continue to see those increase. And like Nick has always said, it's sometimes you just can't help it, and it is what it is. Does anyone have any questions? Oh, okay, thank you.
Okay. Thank you, Carrie. All right, now we'll go to the director's report. That would be Sarah with agency updates and personnel updates.
So I'm gonna pass this out, so I have some time here. That's what I was waiting for.
Oh my gosh.
Our aging and disability and senior services unit has worked extremely hard on this Price County Senior Living Expo. And I just you guys got it hot off the press. They just had finished out the brochure or the poster that they're going to be hanging up. But they have about 30 vendors that are coming to this on October 14th. It will be over at the Phillips Municipal Building, and it'll start at 12 at noon till 6. There will be a free lunch, and until it runs out, Aspirus is putting on the lunch, and are their big sponsor of this. And so Phillips Cafe is catering. They have music by Red and Lisa Higgins. And then from 2 to 3, there's a falls prevention presentation with Kristen Bucky for physical therapist from Aspirus Health, and Lane Bishop, the pharmacist from Lakeview Pharmacy. And then 4 to 5 is Money Smart for older adults presentation with investigator Taylor Drake from the Price County Sheriff's Department. I thought they did a great job on putting this together. So if you see people, please let them know to attend this. I believe that there's going to be a lot of great information at this here expo. The BART bus is offering free rides. Of course, it'd be 5 miles in the radius, but they will bring you in if you're 60 and over. They will bring you in, or a veteran. will bring you to the expo, to the Phillips Municipal Building. So that's pretty exciting.
So I'm assuming these handouts will go to all the dining sites and.
Yes, they'll be
everywhere.
out everywhere. Yes. Yeah, so, yeah, so they've worked extremely hard on this.
Looks fun. That's cool.
Is the catering for lunch or for dinner time?
I think it's probably going to be throughout the day.
All throughout
Probably
the day.
would be
Okay.
my assuming. I don't know, but I'm assuming that's what it would be.
Okay.
Well, supplies last.
Yeah.
I see that. So
Yeah.
that's why I was wondering if they were planning at noon or they're planning on set up at 5 or.
Yeah, no, I think
Exactly.
I think it's going to be throughout the day.
I can see that question coming to me by a
yeah,
resident.
that is
of,
true.
When is the food?
Maybe.
So,
Maybe since you
just-
guys are the
just-
first one, that's maybe what I'll do is see if they haven't made them, send them up. Yeah.
Well, I
That's
would
okay.
assume if it's at noon, it's gonna be lunch first and then, and there's.
Anything.
That's what I would suggest, because if it's gonna bring somebody, then they're gonna be there to wanna stay for the rest of the stuff. You know, whereas if it's a meal and they're looking more for a free meal, like Brian and I were kind of insinuating there for a second. Just a thought, so.
No,
Because I know I'll get a question from a couple
yeah,
of my
okay.
constituents about it, so.
Absolutely. So I'll
Thanks.
find out. And then on the other side, they have the other highlights with public health is offering health screening and flu shots. Big thing is bring your insurance card. ADRC dementia care specialist will be available to complete memory screening. And then the Price County Energy Assistance Coordinator will be available to complete the 2026 applications. All right. Next, I had mentioned about Forest County with our Northern Income Maintenance, where they will be leaving. And one of the reasons why they'll be leaving our consortium is they had a worker in the Northern Income Maintenance who did other job duties while they were supposed to be doing the Northern Income Maintenance. And the Northern Income Maintenance, they take it for the whole consortium, so it's not just Forest County. So they were using them for maybe taking an intake, somebody that walked in, answering phones, and so that was pretty concerning to the consortium. And then also, they had a position open and they couldn't fill it for a full year. So that was putting a lot of stress on other counties. So as of January 1st, they will be with the state and not with our Northern Income Maintenance Consortium. Personnel updates, as you can tell, that we're pretty much full, except we have one vacancy in the children and youth for social worker position, but we're kind of putting that at hold since she has so many new workers. So we're pretty excited having full staff. I think the workers are too. And does anybody have any questions?
No, nothing. All right. Well, thank you, Sarah. It's too bad you don't have more to talk about.
What else can I think about?
Just an FYI, on October 14th, we have our county board meeting, so that'd be a good time for our county board members to zip over for a lunch over at the expo possibly. So maybe we can push that a little bit. Yeah. And then remind them, go eat over there. All right, well, I don't see anything else to speak about. Our next meeting is September 10th. And as far as I know, it is a go. I see we have some things that'll be on the agenda anyway. So it's been kind of a low key, may not be for all of you working in your buildings, but for meetings, it just seems like they're kind of, yeah, it's kind of nice though.
That's
huh?
kind of why our new report wasn't quite finished, just due to a lot of stuff going on and from the managers and trying to figure out. And Dawn was brand new and trying to get into certain programs to find numbers. So there was a lot of things that kind of took place that kind of held us back in trying to finish that report.
I think it's going to be real good.
Yeah.
Yeah. All right. Well, at this point, without any objection, meeting is adjourned. Turn your microphone.